one, fire.
There's always something that goes wrong every single time that you try and do something live. Hi from Peterborough, Ontario. I'm not sure you can hear me or not. Hang on. Too many buttons to push here. Anyway, it would appear maybe I'm on, just not if you can hear me. Let me know if you can hear me. This is a terrible situation. Flying by the seat of my pants. Moments ago, I had to run next door to the Canadian Tire gas station and beg for batteries. We've got a little mixer here that is supposed to take the audio and feed it to you. Lots of static. Yeah, I figured there might be. Fuzzy audio. Well, that's not what we want for you guys at all. Can you hear me okay? Okay, so I'm going to do something here in just a second. Anyway, I'll just keep blathering on while I try and fix this. So, yeah, obviously I'm having... Oh, no, you're apparently supposed to be able to hear me fine on this. Fuzzy audio, though, they say. Anyway, echo audio. Oh, I think I know what that is. Hang on. Let me know if that's better. I'll hang out for a couple of extra minutes if that's what it takes to get this conversation done. No, it's staticky, they say. Yeah, Lori, I apologize. So I am on the road. And, all right, stand by. Stand by one moment, please. You know what? I don't have standby music. Hang on. Hang on. Dun, 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 dun. Dun, 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 dun. Dun, 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 dun. Okay. Hopefully this has resolved the sound issues. There we go. Okay. Now, I can't guarantee that anybody actually listening on the BTR audio stream is hearing me, but here we are. So, yeah, this is a fly-by-the-seat-of-my-pants kind of day. I've got this tiny little audio mixer that is supposed to be the brains of the operation, and it runs off of, a specific audio cable. Cell phone cable, as a matter of fact. I forgot one. One does power, the other does audio. I forgot one. So, okay, no problem. I can run it off batteries. Literally next door to the hotel here in Peterborough, there is a Canadian Tire gas bar. You know what they don't sell at the Canadian Tire gas bar? Batteries. For whatever reason, they do not sell batteries at the Canadian Tire gas bar. It makes absolutely no sense to me, but there you go. I'm just going to do a quick little... Do I have a headphone jack on this? I do. Let's just see if that doesn't feed the audio to the radio station. Doesn't appear that it does. Anyway, hi from Peterborough. I'll just have a conversation with y'all who are watching on, Best Buy is down the street. I literally had 5 minutes, guys. I literally had 5 minutes. Got here late. There's a bit of construction between Ottawa and here. Just, nothing major, but just enough to slow you down and make you a couple of minutes late. My check-in actually is not until 3 o'clock. but I stay here quite a bit because I do quite a bit of work at Peterborough. And Jennifer at reception was very, very kind and let me in. So, okay. We're not on the air on BTR. That's unfortunate. I can't do anything about that. But we are on Facebook. We are on Twitch. We are on YouTube. And we are on Twitter. So what I'm going to do, obviously, is not be able to take your phone calls today. That's unfortunate. But you can certainly text 613-604-6464. Here we go again. This is what I want to talk about with you. I want to get, well, here's the question. Are you ready to mask up again? That's the conversation I want to have, because every report you're seeing now is talking about, hospital emergency rooms. The wait times are 44% longer than they were a year ago. The news out of CHEO is it's appalling. They're having to add ICUs. Young kids are getting sick. And we're getting into flu season, and there's other viruses out there right now. So, everywhere you look, if you're following, Ottawa Health, they're advising mask up. I just went to a pharmacy here in Peterborough. Same thing. They're advising, please mask up before you get into the store. Premier Ford has already weighed in saying, I don't want to make that mandatory right now. I'm hoping that people will do the right thing. So in your opinion, what are you prepared to take? How much are you, how far are you prepared to go? Are you prepared to wear masks? Are you prepared for more restaurants to be closed? Are you prepared for, limiting numbers of people into stores, etc.? Because here we go again. And also, second part to that question, what is going on at the emergency rooms? Is this, are the people in the emergency rooms, and I haven't been to one in a long time, fortuitously, but if you've been to the emergency room, who's there? Is it people with the sniffles? Is that what's going on? Or are these like legitimate sicknesses, and we just have a doctor and nurse crisis going on and not for them? So, your comments. Anne, I can hear you fine now. See, Anne? I keep and keeps asking me technical questions as if I'm some sort of technical wizard. And I'm clearly not a technical wizard. We had a few issues, but I'm glad you can hear me fine now. Are you prepared to mask up again? Lisa is in Kitchener-Waterloo tuning in. She says no. Terry also says no, but I live in Quebec. Well, I don't think the virus knows that there's a river between us, Terry. This morning I had a tooth extraction, says Craig, came out in pieces. The doctor and his assistant sure had a struggle. They were absolutely fantastic. Well, that's good news. Cindy answers my question. No. Kathy says, no, if the vaccines are good, then there should be no need to mask up. Stop the fear mongering. Okay. And listen, I'm not here to cast judgment. I'm just looking for your input. I want to get I want to get an idea of what people are thinking, to sort of get an idea as to where we are at on this thing. And I want to see if maybe somebody who is of the opposite mind of you says something that maybe makes you think a little bit, regardless of what side you're on. Okay, it's your call. And again, I can't take your calls today, sadly, because I messed this up technically. 613-604-6464 if you prefer to text. Otherwise, on Facebook, Twitch, and YouTube. And I apologize for the screw up. Let's see. Let's go to Jules the Dancer. I still have to mask at the doctor's and at the retirement home when I see my mom, so it will make no difference to me. My wife works retail, and she's in the mask all the time. In fact, I drop her off at any store, and she just automatically masks up. I don't think the masks are a huge deal. I would much rather have to mask up in the wintertime than in the middle of July. I wasn't very happy about masks in July, but this time of year, no. So, I mean, something's coming. Something's coming. The numbers are spiking. The hospital waiting times, like I said, are up 44%. Are you prepared to mask up? Are you prepared to, do takeout only at restaurants, etc.? Where do you stand on this? Tina Marie says, we have family and friend's granddaughter, 3 months old, in the ICU at CHEO currently in induced coma, pneumonia, among other issues. I listened to a doctor, works at Sick Kids Hospital earlier today. They're overwhelmed. They are absolutely overwhelmed. They're starting early. They're working late. They can't just walk away from a patient when the shift is over and away you go. This is taking a heavy, heavy toll. There's been 2 years of this. So where are we at, come springtime? So again, are you prepared to mask up? Are you prepared to close your restaurant, close your business for a little bit? Are you prepared to stand in line 6 feet apart again? Basically, only go out to walk the dogs and stopped going to a doctor's appointment, so I have not worn a mask, says Satan's Playmate, with the best name ever. Yes, still do it anyway, says Laurentian View Terry. I'm curious, okay, those who are masking, are you being bothered by folks? Because there is a certain segment of the population who ridicules this, unfortunately. I'm all for freedom of choice. If it makes you feel comfortable and safe, then wear it. It's pretty simple, and just, can we stop with these Facebook comments? You're driving in the car by yourself with your mask on. You look stupid. We got to stop with that judgment. For whatever reason, that person's doing what they think is right. And that applies to both sides. Not wearing a mask, wearing a mask. All right. Post my operation, says Craig. I went to my pharmacy and hardly anyone was wearing a mask. In a pharmacy? Mind you, I shouldn't be surprised, Craig, because the pharmacy I go to, right outside the door, where all the cancer patients and people with pneumonia and stuff go to get their prescriptions. Yeah. People stand around outside the door smoking cigarettes, waiting for their prescription. So it shouldn't surprise me that people are in the drugs. And now, that said, I just went to the drugstore to buy those batteries, which turns out to have not, achieved what I wanted them to achieve. I didn't have a mask on, and they asked if I would, and I was like, I'm sorry. So, this kind of thing. They're like, don't bother. They would have sold me one. By the way, the lady at the pharmacy that sold the batteries, they don't even sell batteries. She just has them behind the counter in case somebody comes running in in desperation. And so she showed me the price. They were $2 at the dollar store, Dollarama, whatever else. And she says, just pay me what I paid for them. So of course the tax on that is what, $2.26. And away we went. I felt bad that I had to use my debit card to buy the batteries because she's got to pay a fee on that. All right. Yes, I teach children, and I have to consider revising my policy. At least we can be in the same room, says Mediad. Yeah, that's an interesting question too. So, okay, so you've got kids who are in school. Should they be wearing masks in school? Again, at least they're in school. Should they be wearing masks? Would you be more comfortable with them wearing masks? Looking for your opinions here on It's Your Call. I am in Peterborough today. Doing something I've never done before. It's a Toronto Maple Leaf ticket giveaway night tonight at the bingo hall. And we're back here on the 19th, by the way, for a drag bingo session, which would be fun. Let's see. I was last week for 12 hours, Lisa. I'm assuming you're talking about being in a waiting room at a hospital. What was going on with the other people around you? I know you're not privy to necessarily find out what they've gone to the hospital for, but overall, you're there for 12 hours. You're making assessments about what people are there for. Broken bones are obvious. People who are bleeding and need stitches, that's obvious. But what's your impression? The people that were in the waiting room ahead of you. Was it coughs and colds and sneezes and people who just don't have family doctors and they're going to the ER? If that's the case, don't you think we need to find an alternative or bill people a fee for using the emergency rooms for things like that? I mean, listen, I recognize the predicament we're in with a shortage of doctors and nurses, etc. Trying to get a doctor these days is impossible. My gosh, we had to get a hold of our doctor for a couple of things the other day. Just trying to get through to the office was absolutely impossible. The receptionist is like a robot. Yes, no, name, please. Health card number. Thank you. Doctor will call you. Bam, 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 bam. And on to the next one they go. They are overwhelmed if you can even find a doctor. Jules says, I will put a mask on before going into a lockdown. Yeah, right. Online teaching was not preferable. You know what? I feel so much for those students. Some, I think, do very well in that environment. I would have checked right out. I wouldn't have had a hope as an online student. I daydream way too much. Leave masking to the individual, says Anne. Okay. Thank you for your comment. I appreciate that. Lori says, I'll just stay away from the crowds. I'll keep it on me if I really had to go into a drugstore or into a hospital. All right. Your comments. Are you prepared to mask up again? Are you prepared to have your kids go to school with masks on? Because it sounds like we are heading in that direction. Ottawa Public Health is tweeting like crazy. Please wear a mask. Wear a mask. The premier is already talking about, I don't want to weigh in on this. I don't want to force people. But if you read between the lines, it's almost one of those, I will if I have to. Mahadi, John, I am ready to mask up. I am on board with Ottawa Public Health. I have elderly relatives. I wear a mask when I am around them. Right on, Mahadi. Hey, listen, no judgment here. It is your choice. I've been, I missed Christmases like most people, with my parents, etc., who are getting up there in age. And if it means, keeping them healthy, putting a mask on and spending Christmas, okay. Like Jules said, I will do that. Kathy, the emergency rooms are full due to the lack of nurses and doctors. Bring back them all. Kathy, that raises another interesting point, something that's been on my mind. So every Tuesday, I produce a comedy show. And when you're at a comedy show, of course, comedians will work the room, right? And they'll talk a lot to the audience. Well, the location we do the comedy nights at, no forks given, is on Somerset Street East, right across from Ottawa U. And a couple of weeks ago, there was an entire table of students who were taking medicine at Ottawa U, taking, some studying to be doctors, some to be nurses. And the inevitable question came up from the comedian: will you work here, or are you looking to go to the States? And they laughed. There must have been a half dozen of them, maybe 8 of them at the table. Oh no, we're out of here first chance. We're educating doctors, nurses, highly intelligent, highly capable people in our education system, and happily letting them walk out the door. And we have this shortage going on. I proposed this several months ago. I think a few of you responded quite nicely to it, or favorably to it, that if we have a doctor shortage, and it doesn't solve it today, but it certainly solves it going forward, what about something like, if you want to be a doctor or a nurse, we'll pay for your education, but you owe us X number of years working in our system before you can go trotting off to the States. Your thoughts on that, if you'd like. Anne says, no, I'm not ready to mask up again. This is not about case counts. It's about lack of capacity, which existed before COVID. If any money was going to anything, I would prefer it was healthcare, not the teaching profession. Thank you for your comment. Joshua says, it's said that a family doctor shortage is also contributing to the hospital crisis. I don't doubt that one little bit. All right, let's go to some of the texts we've got here. Hi, John. On holiday in Brighton, UK, maybe 5% or less masked over here, says Mort. In the UK. Yeah, the UK was quite the hot spot, from in the first round of the pandemic. Interesting to hear that right now. I'm definitely against government mask mandates, says Chris. Thank you for texting me at 613-604-6464. Here's one out of the States. Hopefully, if people start wearing masks now, we can prevent another lockdown. I just don't think we can do another lockdown. We can't afford it. We can't afford to subsidize the businesses that we forced to close. The businesses that are having to close certainly can't afford it. The employees can't afford it. Back to Mediad. Many children have RSV right now. It's viral, but some cases can be serious. Yeah, that's it's a new pulmonary disease, and it's something that I don't think I've heard of before. So on top of everything else, we now have this third layer added to it. And again, I apologize. I am on the road today, guys. I know we're not streaming to the radio portion of things. That horrifies me, since it all started with the radio station. But thanks for sticking with me. I will eventually. I got a number of trips to do back and forth, so I will iron this out. And of course, the show is, as you know, brand spanking new. And thanks, by the way, for your continued comments and support of the show. Those are welcome always. Milky, MILKY, at blasttheradio.com. Lisa says, emergency department was filled with broken bones and a lot of kids with the flu. Yeah, I mean, what else do you do, right? Your kids have got the flu. There you go. A text at 613-604-6464 from Alberta. As far as healthcare in Canada goes, we need to look at having something like patient first. Take a look at it. It would take the burden off the emergency rooms. Okay, that is called patient first. Yeah, the term private healthcare, I think, scares the hell out of a lot of people because they look to the States. But again, as we've discussed, with Lowell especially, there's a lot of your healthcare already that is private. It's paid for. As long as it's paid for by OHIP, I don't think people have objections. We need to find a different term for private healthcare, because I think it conjures up in people's minds that they're going to be out of pocket for that. And maybe in some cases they will be, but as long as it's a choice. All right, Linda says, I have a friend who works at CHIO who says most of the kids are coming in with fevers and breathing issues and being diagnosed with RSV, and that parents aren't able to handle it at home because they are coming to CHIO for Advil and Tylenol because they can't find it in stores. Wow, you know what? I hadn't even considered that. You're right. You're right. We got a problem with Advil and Tylenol. So that's what people are doing then, is it? They're going to the hospital in hopes that they've got a supply and can get their kids on that. Oh my gosh. It just, I mean, at every single turn, right? This thing just gets worse and worse and worse. Back to Craig on Facebook. Terry, 2 weeks before COVID hit, I had a root canal. Never did have a crown. Okay, we're talking amongst ourselves now, guys. Talk to me. No, I get it. The masks have lowered people's natural immune systems, so now even the common cold is hitting worse. That's true in some cases, I think, although this doctor that I heard talking today, who, again, works at Sick Kids Hospital in Toronto, says that, there are some, like a lot of cases that they're seeing in children. These are 6, 7, 8-month-old children. They weren't around pre-pandemic, right? So they didn't have this strong immune system that has been hibernating for the last little while. So he's not, and this is one doctor's opinion that I happened to hear on my way down to Peterborough today. He's not convinced that that's absolute, but in some cases I can certainly see that would be the case. So the question I have before you is, are you prepared, or how far are you prepared to go if we have to deal with COVID-19 and the flu, etc.? Again, the hospital rooms are full, especially as it pertains to kids and kids' hospitals. How far are you prepared to go? Will you mask up again? Will you fight it? Will you resist it? Your thoughts. Facebook, Twitch, Twitter. And again, you can text me at 613-604-6464. Vinyl Spinner. Cool name. And thanks, by the way, for being on Twitch, twitch.tv/BTR Radio. You can subscribe if you are an Amazon Prime subscriber, and it doesn't even cost you anything, but Amazon will send us $5 a month on your behalf. It's a little complex to do that. I've reached out to Twitch. Can we simplify this, please? Vinyl Spinner says, I currently mask and will keep on doing so as my wife is immune compromised. Yep, totally get that. Kurt says very simply, nope. Okay, Kurt is not masking up. This is interesting because, this is kind of where I thought we'd be. We're really 50-50 on this. Back to Terry. Last time I masked up to get into the lottery and booze store. I'm willing to make that sacrifice. Okay, Terry. Terry just sits there cracking himself up all day long. Sometimes you get me too, Terry. The people who have COVID are the ones who have been vaccinated. Stay home if you are sick. Tina Marie is on Twitch. If there are large crowds, I mask up. All right. Peter says, senior home staffs are still making them mask up since the beginning. Ford and his friends in the mainstream media are pushing it again. Meanwhile, in Florida, they dropped the nonsense, but they are pro-people and not anti-people or business. Okay, Peter, but, in Florida, they do admit, and by the way, I do a show every day in Florida, so I pay close attention to what's happening there. There's a lot of, they do what they want down there. It's the Wild West. It really, really is. And DeSantis in charge, he thumbs his nose at the whole thing. But the reality is the numbers are scary. The numbers of the sick and the dead in Florida are scary. Sure. Do what you want, but it comes with a price. Anyway, I value your opinion, and I appreciate your opinion. Thank you. Nobody has said anything to me when I'm out and about, says Vinyl Spinner, wearing a mask. That's good. That's good, because you do hear it under your breath, and you hear it, certain talk shows and certainly, on your social media, mask, face diaper. Do you is my opinion. If it makes you feel better and safe, why not? That's my thinking as well. If it makes you happy, you do you, I'll do me, says Lisa. All right, back to Midiad. I think most healthcare workers will tell you the crisis began before 2020. Pandemic exacerbated that. I'm right there with you. We all knew for a long, long time that our healthcare system was in a bad way. Like, alarm bells were sounding for a long, long time. And exactly the worst case scenario happened. We ended up with something that overwhelmed the ICUs. We didn't have enough beds. And that's what they were talking about when they would say flatten the curve. It's like, we don't have enough beds for these people. And and that was the real crisis is in the hospitals. So yeah, I agree. So how do we fix it? I guess that's a whole other conversation for a whole other day. But we need to look at, like, there's no fast fix for this. We can't just snap our fingers and put doctors and nurses into place today. Like I said, the ones that are graduating tomorrow, they don't want to be here. So what are they seeing in our healthcare system that makes them go, nope, rather go south, thanks very much. I'm allergic to vaccines, says Satan's Playmate. No childhood vaccine was forced to get C19 to continue search and rescue, end up vaccine injured. Okay. I've never had anyone say anything, says Lauren from View Terry. That's good. I think a lot of this is in our heads too. We're wearing something that's unusual, and we sort of, it's like when you walk out in your Halloween costume. Are people really looking at me? I went to church and only about 4 people were masked, says Lori. One was me. I was getting looks like I had a disease. Yeah, there's never any judgment in church, right, Lori? I love church. Peace be with you. Peace be with you. I love you. I respect you. Then you get to the parking lot after church and you're all cutting each other off, trying to get to the Tim Hortons on time. First comment in from Mary. Mary, thanks. And again, my apologies. The setup is not what it should have been. We're not streaming to the radio station, but we are streaming on social media, which is where I get your comments from and read them. So it just made sense to be here. Again, thank you for being patient. Mary says, in certain circumstances, of course, I am prepared to go backwards with compulsory masking. Absolutely. Wait. In certain circumstances, of course, I am prepared. But to go backwards with compulsory masking, absolutely not. Okay. I finally made sense of what you're saying. Again, I am not in my regular environment. I apologize. Simon, Simon, thank you for your comments on the show the last few days. I've really appreciated that. I refuse to mask, says Simon. If masks were so effective, COVID and other illnesses would have been eradicated long ago. Many COVID policies were never based on science per WHO, CDC, and Pfizer, Moderna. All right. Again, listen, I'm not here to cast judgment. I want your opinions. I want others to hear your opinions. I want people to know what others are thinking. And hopefully, again, my search for some common ground will mean that maybe you've made a bit of a shift, to the middle, and somebody on the opposite side has made a shift to the middle, and we're better off for it. I want to turn the temperature down on some of these yelling and screaming matches that are going on. It's not mandatory in school, says Linda, but my daughter is wearing it again when she's around the kids. They are a sponge full of germs. You know what? I'm kind of surprised teachers hadn't been wearing masks in advance of this anyway, because you're right. They're little germ collectors, kids. No more masks for me, says Peter. If you want to wear a mask, then do it. Arrest me. Fine me. No more masks, period. Lisa, lots and lots of broken arms, broken body parts, and babies with the flu. Oh, that is so sad. And like you waited almost a day just to see your doctor. Renee says, when I'm on service calls, I wear a mask inside people's homes. People tell me you don't have to wear a mask, but I still do. That's interesting. The last time I had a service person in my house, they were there to fix my hot water tank. And just the number of checks, like, has anybody had a temperature? Have you been feeling sick? Have you been out of the country? Before they'd even come into your house. Is that still going on, I wonder? Let me know. We've still got a couple minutes here on the show. Let's go to Craig. Yes, charge the sniffling idiots that use the ER as walk-in clinics. I agree. Emergency. I feel the same way about people who call 911 because the pizza place is closed. Charge them. Stop wasting my time. Tina Marie, I'm currently waiting for cancer surgery. What? Tina Marie, it's been a long time since you and I have obviously had a conversation. I'm so sorry. She says, I'm on a cancellation list. They said it can take months. This is Canada's healthcare system. This is what the world looks at and says, oh, you got free healthcare in Canada. What's that like? Must be so wonderful. If you're listening in, does this sound wonderful to you? Okay, it's free, but at what cost? Joshua, back to you. I feel like the burden of masking and threat of lockdowns is partly due to a broken medical system, and we never seem to hear any solutions. Hard to argue that. Lisa H. Hi, John. Hi, Lisa H. That was awesome. USA pays doctors and nurses much better. Yes, they absolutely do. And so do we then need to look at some sort of private and public healthcare system where you've got an option? Okay, so Tina Marie, for example, is on a wait list for cancer surgery. if she had the option to pay money, if she was able to get that faster privately, should she not have that ability? Of course she does. I suppose she could go to the States. Could we not have that here and take some of that burden off? Asking for your thoughts, planting seeds. Pay the students' loans, have them sign contract to stay 10 years. There you go. So you're agreeing with my plan. Look at that. Finally, somebody agrees. And I agree. They have to monitor what's going on at ERs, who's going. Are they mostly people with no family doctors? Only emergencies should be going to ERs. I think they should be allowing businesses to decide without government telling them to do it. At my gym, half of us wear a mask and half don't. And then everyone is unmasked doing the workout. So what's the freaking point of putting a mask on in that situation? Yep. Lisa Hughes is now on Facebook saying hi, peeps. Oh, okay. It's where's Waldo, but where's Lisa? She's on Facebook. She's on YouTube. Lisa has us surrounded. Valda says, I don't believe people will concede to another lockdown. Valda, I think it's going to be a tough sell. I really, really, really do think it's going to be a tough sell. My daughter had RSV as a young kid. It was not fun, says Linda. Wow. I think it should be a personal choice, except in health situations such as hospitals, visits to doctors, dentist offices, labs, etc. But in stores, a personal choice. Okay. Yeah. Love your new show, John. Miss Lowell, though, says Lisa. Lisa, thank you. I'm enjoying this. It's a little nerve-wracking, I'm not going to lie, but I really felt, listen, you can't be around Lowell for almost 500 episodes and not feel ready to do this. I just wish that I got this set up right today. I really feel bad about that. I'm a bit of a perfectionist. I don't know if you know that. I have some OCD. And when things don't go right, it scares me. And here's the thing, right? I'm in Peterborough because I'm doing the sound for their big Toronto Maple Leafs ticket giveaway tonight at Delta Bingo. So if I can't get the setup for my own radio station right, it has me started going, oh God. When I get to the bingo hall, what next? But stick with me, folks. I will smooth things out. And I think we're onto something good here, too. Thank you very much for your comment. Yes, kids, Advil, and Tylenol are short. We have none in the house. If we need it, then I'll find out what to do. I don't want to hoard. Gee. Things you don't think about, right? When you don't have kids. I don't have kids. I just, mind you, I don't think I've ever had Tylenol and Advil in the house. It's always been like ibuprofen. Back to Simon on YouTube. The fact the government thinks they can force us to mask or lock down shows us how weak Canadians have become. Stop accepting everything this corrupt government shoves down our throat. Okay, Simon. And you're entitled to that opinion, and I'm not even going to argue that, but I would make the case that, you know what, just about every government on planet Earth in the initial stages of COVID, that was the solution. Feel free to come back at me with your thoughts on that. That's what this show is for. What is going on in our healthcare is government inflicted. Nurse shortage. Try saying that. Nurse shortage, doctor shortage, medicine shortage. Back to Lisa. I went to the hospital to get a giant lump cat that was infected in my back. And when I told Gemma I couldn't handle the pain of them doing it without putting me to sleep, they left me bleeding from the cut. They started with no blankets, no pain meds for 5 hours until they could put me to sleep. And then I left without a care sheet, without a safe person to take me home. Guys, we have problems. I hope you're writing to your MP and your MPP about that. That sounds horrific. Vinyl Spinner. You touched on children's Tylenol and Advil and the shelves being empty in Canada. We called down to a pharmacy, a family member down in Florida, and asked what the situation is with children's Tylenol and Advil. And they said the shelves are full. And there's not an inventory issue down there. So what is Canada's issue? I say that some backroom games are being played. Well, the RV passed inspection. Maybe do I need to be a drug runner? There you go. That's how I'll make my fortune, being a Tylenol and Advil drug runner. Ogdensburg isn't that far away. Guys, I promised you, because I was a little delayed in getting my setup, I would go a little longer here. Let me just get down to the bottom of the comments. We'll wrap it up here in just a matter of moments. Thanks for sticking with me again. Growing pains as we get the show up and going. Kathy says, it isn't because we don't have enough beds. The government shut the beds down. Yes, exactly. And you're right. And it's semantics, right? It's the language being used. The beds are there. It just, the beds they're sitting in rooms that, well, we've deemed can't use those. You can use it as an office if you'd like, and people are. That's so wild to hear of graduates leaving for USA. Listen, Mariette, I knew where the comedian was going with that. They obviously have heard it in other situations, and that's obviously a thing in the medical community, the student medical community. I'm here to get my license and make my fortune in the States. Bye-bye, Canada. Why are we educating our young only to, and look, good on you, I guess, but when we've got a crisis, we got to figure out a way to retain these people here. Sonny says they make much more money going south. It's the brain drain that's been going there on since the 90s. Yeah. And like I said, Sonny, we got to figure out what to do with this. All right, let me jump ahead to some folks who haven't had a chance to get a comment in here. Chrissy says, I'm in a clinic. We still mandatory wearing masks. Get your flu shot, peeps. You know, I've never had a flu shot. I've done the COVID shot. I've got 5 of them. I've never done the flu shot. Don't ask me why. I don't know. I don't go many places. So I haven't been really, freaked out by the flu. Renee says, my technician asked questions before entering the homes for their safety. Yes, obviously. That's good. So that's still going on. Okay. Oh, yeah, got it. All right. You're answering my question from earlier. Is that still going on? Bilingual labeling for kids, Tylenol, Advil from today's Toronto Star. Is that really what's holding it up? Because we need bilingual labeling? Can we not? How many times do you buy something and it says right on it, printed in Canada? We obviously have the ability to print things. Can we not print labels and slap them on? If that's really the holdup, come on. Come on. You remember, if you ever watch Big Bang Theory and Penny has this idea for penny blossoms, these little hair barrettes with flowers, and they start making them in their apartment and they can't keep up with demand. Do we need to get together, guys, and do like a penny blossom night where we're all just slapping stickers on the Tylenol bottles that we've got from the States? I don't know. Sue, we haven't heard from you. We're recovering from COVID and will mask out in stores, etc. And anyone who wants to always could, but not feeling like it needs to be forced, except in high-risk places like medical or long-term care. And on and on and on the comments go. Guys, thank you so much. Wow. Overwhelming response. Despite the technical snafus. Again, I apologize for that. I'm embarrassed by it, but I know you'll let me off the hook on that. We will fix this when we are back tomorrow.